So preventative care is so important. We all heard from Dr. Mehta and Baroness as well. How many of you know lifestyle medicine? Anybody here? Apart from that? Okay, fine. You also know, that's fine. Thank you. It's a relatively new specialty in allopathy. It has been, it started in America about 20 years ago, and it moved to UK now and globally as well. About 6-7 years ago, it came to UK. And there are about 6,000 plus, or nearing 7,000 certified lifestyle medicine professionals all over the world. And this is relatively new specialty, but it has got some principles based upon Ayurveda as well. That is the reason I'm here today to speak about it. Next slide, please. I've got some different hats to wear. I am an anesthetist, a lifestyle medicine physician, master health coach. And the reason I'm here today is I'm from BAPIO, representing BAPIO, as well as to talk about lifestyle medicine physician, lifestyle medicine as a specialty. I have been an author and a master health coach as well. And I do speak about lifestyle medicine and its importance in various chronic diseases and in rehabilitation as well throughout the world. And I have been vice chair for the BAPIO for Health and Wellbeing Forum for the last few years. And since then, I got to see how impactful lifestyle medicine has been to the doctor members, the physician members, and their families as well. And yeah, next slide, please. So we all know about Lord Darcy's report recently, which has come out in 2024. The main features, the main problems which Lord Darcy has pointed out is that NHS is in critical situation, but with strong vital signs. So we can improve the problems which we have. And the key issues where we all know so many people are waiting for surgeries, for appointments, for anything for that matter, they're all waiting. 300,000 plus are waiting for over a year for treatment, which is 15 times increased compared to what it was in 2010. And then 1 million are waiting for the mental health services as well. And 13% of NHS beds are occupied by patients awaiting social care. And 11.6 billion backlog maintenance bill. And 800,000 increase in economically inactive due to long-term sickness since pre-pandemic. So obviously, what in Lord Darcy's word is urgent need for paradigm shift is needed from diagnose and treat to predict and prevent. Obviously, Ayurvedic principles, and we all are talking this since morning, that we should look into the model of predicting and preventing it. And NHS care is sick care, because whenever we are sick, we go and use the care from them, right from in the form of prescription for medicines or in the form of surgeries as well. So we have to shift from sick care to the health care. Healthcare involves all kinds of prevention: primordial prevention, primary prevention, secondary prevention, and tertiary prevention. So if you look at it, the slide is more already, yeah. So the current, that's fine. Okay, next slide, please. So obviously, to sum it up, the current crisis is that there is an increased surge in multiple long-term conditions, which are non-communicable diseases. There's a rising mental health needs, reduction in preventative screenings, public health grant is cut by 25%, deteriorating health status across the population. So what we can do in NHS then with all these problems? So rightly, we have to go back and look at the whole person care in the community, start from the community, start from the family, start from where you are, work on preventative aspects which are evidence-based, which could be Ayurvedic, which could be related to lifestyle medicine, or which could be related to any other specialty as well. Next slide, please. So some of you know what lifestyle medicine is. Lifestyle medicine is nothing but it's an evidence-based approach using the interventions to prevent, treat, and reverse chronic diseases. What I mean by chronic diseases here are the ones which are non-communicable, which are non-infective. So obviously 80% of our patient visits to GP or any doctor for that matter is for these problems. So if you apply this evidence-based lifestyle interventions, we can prevent so much and we can reverse all the Lord Darcy's findings. So the 6 pillars which lifestyle medicine involves is, obviously this is from Ayurvedic, again some things are from Ayurveda, but these are more evidence-based. That's why it's more accepted in the country, in the NHS as well. They have accepted lifestyle medicine so far that even the Royal College of General Practitioners have a separate specialty module for them. So you can actually specialize as a portfolio pathway for lifestyle medicine as a GP. So that much acceptance is there for lifestyle medicine in last 7 years. So 6 pillars: nutrition, physical activity, stress management, sleep, relationships, which is positive connection, and then avoiding risky substances, which could be smoking, alcohol, could be any other risky substances. So these are the fundamental pillars of lifestyle medicine. I can vouch, obviously, Ayurveda has got similar principles, but obviously these are more evidence-based, that's why more accepted. And the potential impact is, again, 80% of chronic diseases are preventable through lifestyle changes. This is from WHO. Next slide, please. So how does lifestyle medicine work? It does address the root causes of any chronic diseases, and it does work on the chronic inflammatory process which starts before any other disease actually comes into picture. It does have some effect on the metabolic improvement and metabolism as well. There is epigenetic influences. Lot of good, healthy lifestyle practices can change the epigenetics and make you much more better in health. Also, it can reverse or prevent diseases as well. Obviously, there's an immune system enhancement as well. There's a stress reduction with which the lifestyle medicine works. Next slide, please. So what is the value proposition for you to take home with the lifestyle medicine? Obviously, it addresses to 80% of chronic diseases. So if you bring that down, we can actually achieve quintuple aim, where better health outcomes for the patient, lower cost for the NHS, improved patient satisfaction, improved provider well-being as well. Because once you start seeing you actually doing something for the patients, your own health starts improving as well, mentally as well as physically. And then advancement of health equity, because these changes, the lifestyle medicine principles, doesn't stick to one ethnic one ethnic group or other ethnic group. It does function in every ethnicity similarly. So again, advancement of health equity. Next slide, please. So how can we implement lifestyle medicine? Obviously, one-to-one consultations, person-centered care. We can use motivational interviewing techniques, health coaching, cognitive behavioral therapy, social prescribing, which is happening in UK already in the communities. And then patient activation measures and group consultations. The group consultation, up to 15 patients, seeing them, somebody who is a chronic disease patient like obesity or a diabetes, if we cohort them as a 15 to 20 patients together and do the consultations, there's a lot of evidence to show that things have improved for all of them. And also the patient acceptance and their own behavior change is much better when you do the group consultations as well. Next slide, please. So how can we use this lifestyle medicine solution for NHS challenges? Of proactive care to shift focus from treatment to prevention. We have got lot of evidence-based strategies which can address the root causes of chronic diseases. They're very much cost-effective interventions with proven results, and community-based approaches that foster social network as well. Empowering patient self-management and behavior change. All this doesn't cost a lot of money. Next slide, please. So the chronic disease crisis, if you see, more than 15 million people, which is 30% of the UK population, live with one or more long-term conditions. Again, this 30%, if you look at our own ethnic minorities, it will be even more. So, and more than 4 million of these people will also have mental health problems. Now, people with cancer, diabetes, asthma, and high blood pressure, even though they are physical chronic diseases, they are at a greater risk of mental health problems as well. Next slide, please. So 86% of premature death from non-communicable diseases occur in low and middle income countries. 460 people die daily from cardiovascular disease in UK. And 50 to 80% of all chronic diseases are caused by only 4 things: unhealthy nutrition, lack of physical activity, tobacco use, and excess alcohol consumption. So you can see the solution here. There's only 4 things. We can right away start from home or our neighbors or friends, telling them improve these 4 things. Then you can imagine how much impact it will have on the whole NHS. Next slide, please. So we all know, again, current issues, rising cardiovascular disease mortality, there's an increase in type 2 diabetes prevalence, 2.8 million economically inactive due to long-term sickness, and multiple long-term conditions becoming more common. Next slide, please. So I'm going to present some evidence base for all the chronic diseases which we have through lifestyle medicine. First, we'll take the cardiovascular disease. This is a global data from 195 countries, which shows dietary factors responsible for 3 million deaths from excess sodium. If you stop eating any processed foods itself, it will reduce your sodium content. And 3 million deaths from low grain intake, low whole grain intake. So there are people are using the processed foods, they're not actually going towards unprocessed and whole grain foods. 2 million deaths from insufficient fruit intake. We all see fruits, even though the quality of fruit is coming down because of the soil quality, but still they are important food, they're very important factors to gain our health. Now, looking at the Mediterranean diet studies, Lyon Diet Heart Study that showed 50 to 70% reduction in cardiovascular events. And more recent Predimed studies, significant reduction in cardiac events with olive oil and nut supplementation. A lot of us snack on the crisps or biscuits or cakes. If you start snacking only on nuts, just replacing it, that's the biggest thing you can do for your own health. And then 40% of mortality reduction over past 40 years. Half of them are attributed to lifestyle changes rather than the medical interventions. Next slide, please. For the blood pressure, we all know about DASH diet. And the DASH diet has shown that there was systolic blood pressure reduction of 5.2 millimeter of mercury and diastolic blood pressure up to minus 2.6 millimeter of mercury. This is almost equivalent to some of the antihypertensives. So if you just change your diet, you can still have lowering of the blood pressure. And cardiac rehabilitation, 26% reduction in cardiovascular mortality, 18% reduction in hospital admissions as well. Next slide, please.
What is DASH?
It's a dietary association for food for this systolic hypertension. But it actually nothing but what I teach in our WAPA group. It's a high fiber and high rainbow diets with some low sodium and high potassium related diet. It's nothing else, very simple. Evidence-based, again, for the diabetes, direct trial results achieved type 2 diabetes remission. Remission, we all know here. And cost-wise, you see for the hospitals, nearly 1,200 pounds one-time intervention, that much it costs only. And compared to 2,564 annual ongoing diabetes care for each patient. The diabetes prevention program, lifestyle intervention superior to metformin, that the DPP program has shown lifestyle intervention is superior to metformin in preventing somebody who is pre-diabetic to type 2 diabetic, as well as type 2 diabetic to progress further. So you can imagine how powerful is lifestyle intervention compared to even metformin. So in America, it's been shown that they are at least $1,000 less expensive over 10 years and greater prevention rates than the medication. Next slide, please. Not only to diabetes or cardiovascular diseases, even for the cancer, EPIC study has shown, which had 500,000 people over 15 years, Mediterranean diets reduce mortality, lower cancer incidence, and 30 to 50% cancers are preventable through lifestyle. And coming to mental health studies, SMILES trial, again, it was a 12-week dietary intervention trial. Patient had one-to-one with dietitians changing their diet, which has shown that it achieved depression remission and superior results to antidepressant treatment. Superior results to antidepressant treatment. It's cost-effective intervention. And stress-related outcomes impact on telomere length, because telomere is the genetic material which is just out on your genes. As you age, it starts becoming less and less. So the stress, if you manage your stress properly, the length will stay similar or it will not reduce, which means you will age even better. And correlation with chronic disease, behavior change, success rates as well. Yeah, next slide, please. Supporting cancer care, physical activity in cancer survivors. This is for the cancer survivors. 38, if you start moving physical activity, well, I'm not telling about physical activity is going to gym or anything like that here. Even if you do 150 minutes of physical activity in a week, 150 minutes, even just a brisk walking 150 minutes in a week, you can get these numbers. 38% lower risk of cancer mortality, 18% of lower risk of cancer recurrence. And nutrition interventions, up to 30% reduce risk of cancer recurrence with healthy diet. Next slide, please. So if you look at the global disease burden study about dietary interventions, 11 million deaths from dietary factors, 25 million disability adjusted life years. 22% of global deaths are diet related. And if you optimize the diet to the plant-based diet, if you start predominantly plant-based diet from age of 20, you will have extra 11 to 13 years to live. If you start at 60, you got 8 to 9 years to live. Even if you start at 80, you got 3.5 years to live more. So you can imagine just shifting your diet from whatever you're doing to predominantly plant-based. Next slide, please. Physical activity, again, there's a medical education gap here. Only 56% of medical schools teach activity guidelines. Students underestimate the health benefits. I'm telling 150 minutes. You all think it's very easy, but nobody does it. That's the problem. And nobody tells you as a doctor, nobody tells you to do that. And the behavior change is much more important. And limited training and exercise prescription as well. People don't know what to prescribe. There are 4 things you have to look at it: aerobic capacity and the flexibility and the strength training and the balance. So people just say, go to gym. That doesn't help. You have to tell them what you have to do in each of the sectors. So that is lacking as well. And sleep study outcomes on the impact of chronic disease, metabolic health effects, better metabolic health effects, and immune system function increases, and disease progression rates come down as well with the better sleep hygiene. Next slide, please. So behavioral change evidence, motivational interviewing, if you can do 80% more effective than traditional advice. If you tell them to go to gym, they will not go. Sit them and do a motivational interviewing for about 10 minutes, 15 minutes, they will change. But you have to give them the small things to change first. You can't tell the whole prescription. Dr. Mehta knows from the group how we did it in the physicians. I'm not talking about any general population here. Physicians, they have changed themselves so nicely. And again, it's better long-term adherence as well. Once you motivationally interview them, they adhere those things to their life for longer time. Cancer prevention evidence. A million women study showed that alcohol consumption risks, cancer type correlations, and prevention opportunities are there. And World Cancer Research Program said 30 to 50% of cancer is preventable through lifestyle, occupational and environmental factors, and the intervention is very effective in these patients. So you see, most of the things are within our control to change and to adapt. Next slide, please. Now, real world implementation data in NHS group consultation outcomes, 10 to 15 patients per session has been shown to have a superior diabetes management and cost-effective delivery as well. And looking at the patient activation measure, it has been shown they have definitely better health outcomes, improved self-management, and reduced healthcare utilization as well. Next slide, please. Economic impact, obviously, there is a healthcare cost reduction because they will be de-prescribing so a lot of drugs, and hospitalization will decrease automatically once the health improves, and long-term savings for the NHS in a whole. And quality of life improvements, their measured outcomes have shown they live very good quality of life. They are much more satisfied, and the functional capacity of the patients have improved much more. The good thing is that if you change one patient to this thing, he will tell other 10 patients to change themselves. So you can see the power here. I know you must be spending at least extra time on one patient to interview and tell all these things, but he will go and change other 10 patients because he's adherent and his mind is so much changed and at a higher stimulatory capacity. Okay, next slide, please. So what my call to action is for all healthcare professionals, adopt lifestyle medicine principles, pursue continued education if you don't know about the specialty, and implement prevention strategies and track the outcomes. And for organizations, obviously invest in prevention programs, support staff training, create supportive environments, and measure impact. Thank you. Next slide. So we can transform healthcare through lifestyle medicine because we have seen prevention is possible. Evidence is compelling. Integration is much more essential with everything else, and future is very promising for this specialty. The key takeaway, 80% of chronic diseases are lifestyle related. Evidence-based interventions show a significant impact, cost-effective for healthcare systems. It aligns with integrated care goals, and it aligns with the theme of this today's conference as well. Thank you.